2 years into the COVID-19 pandemic, nations are looking for ways to coexist with the COVID-19 pathogen without shutting down their economies again with lockdowns. The United States reopened its borders in November. Britain has eased testing and quarantine requirements for vaccinated arrivals. Even countries that once had strict COVID-19 control measures, such as Australia, New Zealand, and Singapore, have all dropped their goal of 0 cases. Instead, most countries are trying to prevent their health care systems from becoming stretched to the breaking point while allowing their citizens to live semi-normal lifestyles. But there's an outlier: China. China is the last country still holding onto a strict zero-tolerance policy. Over the past 2 years, Chinese authorities say they have contained more than 30 COVID-19 outbreaks, including ones caused by the more contagious Delta variant of the coronavirus. Strict health care measures help keep the infection at bay, including mass testing, snap lockdowns, and a recent outbreak in China's Zhejiang province, a major industrial and export hub on the country's east coast, left more than 500,000 people in quarantine, hundreds of factories shut down, and most flights out of provincial capital Hangzhou cancelled. In November, Shanghai closed Disneyland, banning anyone inside from leaving while officials performed more than 100,000 COVID-19 tests after a single positive case. With the emergence of more contagious varieties, such as the Delta and the new Omicron strain of the coronavirus, Beijing seems to be doubling down its effort to contain any sporadic outbreaks. You have to give China a lot of credit for keeping COVID so low for 2 years, but now I think we have passed the point where we can expect to prevent cases because it's simply so transmissible, and eventually China is going to have to open up to the world. Experts pointed out that rigid disease control measures will be unsustainable to maintain as more contiguous variants appear across the globe. The new Omicron variant has been detected in at least 89 countries since it was first discovered in South Africa in November. Health officials say the strain may be much more transmissible than Delta and more resistant to COVID-19 vaccines. A recent study by a team from the University of Hong Kong found the Omicron variant multiplies 70 times faster in the human bronchial tubes than the Delta variant, leading to faster transmission among humans than previous versions. Delta is already believed to be more than twice as contagious as previous variants, according to the Yale School of Medicine. Chen Shi, an associate professor of health policy and economics at the Yale School of Public Health, pointed out that China has shifted from a zero-tolerance policy to a dynamic zero-tolerance policy, meaning that the country acknowledges it is impossible to keep the case number to 0. Yet according to Chen, Beijing is unlikely to relax its strict COVID-19 policies anytime soon. China's approach now is wait and see. There are 2 major events in China in 2022, the Winter Olympics and the 20th National Congress. Extensive quarantines. Government data released last week showed retail sales struggled and investment continued to weaken, suggesting that more frequent outbreaks and lockdowns are taking their toll on the economy. For example, the recent lockdown in Zhejiang province, a major manufacturing hub that accounts for 6% of China's total economy, is triggering local restrictions and factory shutdowns. Further supply chain disruption is a significant possibility, analysts from London-based Capital Economics wrote in a research note last week. Chen from the Yale School of Public Health pointed out that apart from economic costs, there are costs related to China's communication with other parties of the world. We see that many pandemics eventually lead to wars, and that's because these pandemics hinder communication, he said. I think the zero-tolerance policy has a negative effect on Sino-US and Sino-EU relations particularly. It's not just China, said Huang Yanzhong, a senior fellow for global health at the Council on Foreign Relations. The pandemic is limiting the movement of people, it also limits the effective communication and exchange of ideas. Huang added, and that is contributing to all this disinformation, misinformation, and conspiracy theories. Other experts argued that China's zero-tolerance policy might give the country a geopolitical advantage for the long term. Raina McIntyre is a professor at the University of New South Wales in Sydney and a principal research fellow at Australia's National Health and Medical Research Council. She leads a research program on the prevention and control of infectious diseases. File. An intubated COVID-19 patient gets treatment at the intensive care unit at the Westerstede Clinical Center, a military civilian hospital in Westerstede, northwest Germany, December 17, 2021. While China's strategy at the moment is to suppress transmission as long as there remains significant transmission globally, experts pointed out some of the costs will accumulate and create a different set of incentives for the country. Unfortunately, most experts expect widespread transmission of COVID-19 into 2023, and there are plenty of plausible scenarios in which it could last further. Most experts also expect COVID-19 to eventually become endemic. Thomas Hale, a professor of global public health policy at the University of Oxford, told VOA. He said that all governments, China included, will need to develop plans for how to manage this disease on an ongoing basis. For an endemic disease, it is very difficult to define success as near zero transmission, he continued, adding that a better metric will be the overall health impact of the disease. He said governments will rely on a mix of vaccines, treatments, increased health care capacity, and containment measures to keep the health impact low.